So I've been spending the last few weeks on a Surgeon General's house call listening tour, where I've been traveling to small towns and big towns across the country to understand more about the healthcare challenges that communities are facing. And I was very happy to be here today in Fort Myers and to hear from some fantastic community leaders about some of the challenges they're facing, but also about some of the initiatives that they are leading. The challenges I heard about today were around mental health, particularly pediatric mental health for kids. There have been some real concerns here that that kind of care is hard to access and that we need to do better in terms of diagnosing and treating mental illness among our kids. But I also heard concerns about coverage, about the fact that while we have more people who have gotten covered through the Affordable Care Act, in fact, 1.3 million people enrolled in Florida, which is a great number, there's still many people who are not insured and don't know about the coverage options. As we've been telling everybody that we have an opportunity between now and February 15th to sign up for health insurance coverage through healthcare.gov. Millions of people across the country, in fact nearly 10 million, have either enrolled or re-enrolled in coverage during these last few months. And we want everybody to know that there are affordable healthcare insurance options available to them. But it's important to sign up before February 15th. So coverage was also an important issue that came up today. And the other issue that was discussed was the challenges we face with obesity and chronic disease. Obesity and chronic diseases are taking a great toll on our entire country, not just Fort Myers. It's costing us in terms of healthcare dollars, it's costing us in terms of lives lost, and this is a challenge that we need to take on.
And I heard this was the third Florida city that you've been in so far. Are you hearing any Florida-specific issues that stand out to you so far?
Well, there are some issues that are specific that I've been hearing more about in Florida. And I will say that it's been a privilege to be here in part because this is my home state. I grew up in Miami, Florida, and it's always great to come back to Florida. But you know, as I knew from growing up here, we do have a large population of seniors in Florida. And there are particular concerns that seniors have, including folks who may not qualify for Medicare yet, but are getting older. So I did hear about real concerns about Alzheimer's. In fact, that the population with Alzheimer's here is significant, and it's an illness that is being underdiagnosed, and that is not always treated as good as we can. So I did hear about Alzheimer's. I heard about some challenges from employers, based around the fact that we have populations in Florida that are transient. We have a lot of people who come down here in the winter and who leave, and so there's a large snowbird population, but also a large tourist industry. And that transitional population can often cause challenges for businesses, which have to fluctuate in terms of the size and the number of employees they have. Some of these businesses, which were telling me today, that they're having trouble getting coverage for all of their employees, in part because sometimes their employees don't know about the health insurance options that are available to them through the Affordable Care Act. So part of what we are trying to do is to see how our healthcare navigators, and these are individuals who can help you sign up for insurance if you're having a hard time doing it on your own, we're connecting them with some of our local businesses so that they can make sure that their employees know about the coverage options that are available.
We've talked a lot about the challenges so far. What is the response that you are planning, things that you are changing to address these concerns?
Well, while there have been a lot of challenges, we've also heard about a lot of opportunities and about a number of initiatives that have been embarked upon here in Lee County. For example, we heard about the Healthy Lee initiative, which was started 7 years ago, and that has brought community groups together with the purpose of making the county healthier, recognizing that to do that, you have to take a multi-pronged approach. You have to bring together not just healthcare organizations like departments of public health and hospitals, but also faith-based organizations, local businesses, schools, and others. And what these groups are, and what the initiative is seeking to do is to improve not only mental health, but also to improve nutrition, to improve the possibility of physical activity and physical fitness. So I heard about a number of initiatives that are promising related to nutrition, related to mental health. But the challenge that we have now is how do we sustain these? How do we study them so we know the impact of them? And how do we expand them and scale them up so that more communities and individuals can benefit from them? One of the things that I'm hoping to do as I travel across the country is to share some of the lessons that I hear and that I learn from communities with other communities along the way. I found that there's a real hunger among leaders, local leaders and residents, to know what's going on in other cities and towns, to know about how they're addressing problems, and to see if we can learn from them right here at home.
The measles outbreak in the U.S., does it get worse before it gets better?
So we have a real problem with this measles outbreak right now, as many of you know. And I want to be very clear that I'm concerned about this measles outbreak, especially because this is something that could have been prevented. In the year 2000, we had declared measles eliminated in the United States. That was a triumph of science, and it was a triumph of public policy. But in the most recent years, we've seen a resurgence of measles. We had over 600 cases of measles last year. And in the month of January of this year alone, we've had over 100 cases in 14 states. So this is a real problem, but the key message here is that measles is preventable. And the good news is that we have a vaccine that is both safe and effective for preventing measles. I want parents to know this, to know that the science is very clear on the measles vaccine. It is safe, it is effective. And if you do not have immunization from the vaccine, then you have a very high chance of acquiring measles if you're around somebody who has it. And just to give you an example, or the numbers around this, if you are in contact with somebody who has measles and you are not immunized, you have a 90% chance of getting measles. By contrast, if you get the vaccine and are immunized, you reduce your chance of getting measles significantly. So the vaccine has a 97% success rate when it comes to protecting you. So it's effective, it's safe, and I encourage all parents to vaccinate their children.
Can you talk directly to the mom at home that might not be sure about getting their kids vaccinated? What's your direct message to that person?
Well, I recognize that parents who have concerns about vaccines are primarily concerned about the welfare of their child. And every parent wants their son or their daughter to do well. They want them to be healthy, and they want to protect them from harm. So I can understand the instinct that some parents may have to wonder about the rumors that they're hearing and whether they're true or not about the vaccine. But to the moms out there, and to the dads out there, to everyone who's concerned about their child, I want to say that this is especially why we need science. We need science to help us understand when there's harm and when there's benefit. And when it comes to the measles vaccine, the science is very clear. And it's clear that one, that the measles vaccine is very effective, and two, that there are no long-term adverse effects from the measles vaccine. And specifically, there is no link that has been found between the measles vaccine and autism. There was a study published some time ago which had claimed that there was a link, but that study has been long debunked. It was found to be a fraudulent study. And the good data that we have, the good science, and many scientists around the world have looked at this issue repeatedly and have said that there is no link between the measles vaccine and autism. So my message to moms and dads out there is to please, please, please vaccinate your children. It's the best way to protect your kids, and it's the best way to protect our community.
Can I ask you real quick about medical marijuana? Voters went to the polls here in Florida last year, very nearly passed it. It may go on the ballot again in 2016. I think you made some comments earlier this week about your thoughts on, could you clarify your thoughts on medical marijuana and states that opt to legalize it?
Well, my thoughts
Met
on...
Team, Whirlpool 3 West. Met Team, Whirlpool 3 West. That is a Met Team, Whirlpool 3 West.
Don't they know we have the Surgeon General here?
When it comes to medical marijuana, we should let science really drive our policy making on this. And this is true for all public health policy, is that we shouldn't let opinions or anecdotes drive our policy making. We should let science drive it. And when it comes to the science, we should require the same degree of high quality and information and science that we apply to really any drug when it comes to marijuana. We have to make sure that any therapy that we give to patients is both proven to be effective as well as safe. When it comes to marijuana, while we have research that is ongoing, I do not believe that we yet have enough evidence to say with great confidence that we know the medical indications for which medical marijuana is both safe and effective. But I'm encouraged by the fact that the NIH and that other bodies are investing in research. I think research is what we need to understand whether or not any substance out there is safe and effective when we're thinking about it for treatment.
Is it as dangerous as alcohol or heroin under its current scheduling? That should be changed?
Well, there are many substances that I know have been under discussion in terms of whether it's medical marijuana, whether it's new substances that we're thinking about, alcohol, tobacco, that have harms and that have benefits. And I think what's important is that we look at each of these individually and try to understand, where are they helpful and where are they harmful. When it comes to marijuana, there are studies that are ongoing, and we'll see what those studies show. And as I've said, before, I believe that our approach to this should be no different than our approach to other medications, in that we should be letting science drive our policymaking.
Given the research and evidence that we have now, scientific research, as America's doctor, should people be using marijuana for medicinal use?
Based on the evidence that we have, and based on what we know in terms of the adverse effects of marijuana, I do not recommend that people use marijuana for recreational purposes or medicinal purposes. We need to have more evidence before we can say that that is safe.
The flu vaccine this year wasn't as effective as it could have been. What's being done now to address that issue for next year?
So the flu vaccine has been a topic of great discussion, and a couple of things I want to say about the flu. One is that influenza affects thousands and thousands of people every year. It causes people to be hospitalized, and it causes deaths, not just among our elderly, but among infants and young children as well. So it's an important illness. It's one that we should take seriously. And I encourage everyone to get vaccinated for influenza, because it can help reduce the rates of hospitalization. It can help keep people healthy. Every year, the effectiveness of the vaccine varies based on how well matched the strains are that actually circulate during outbreaks and the strains that were used to actually create the vaccine. And it has been recognized that we need to do better when it comes to creating a vaccine that's much more effective than what we had this year and than what we've had in years past. But the message that I want to still convey is that it is important to get vaccinated. Even if the protection is not as high as what we would want, there is still some protection that people get from the flu vaccine. So get vaccinated, make sure that your loved ones are vaccinated, and we're continuing to work on developing better strategies for vaccines. There's a lot of research and efforts that are ongoing at the National Institutes of Health and within the broader Department of Health and Human Services to see how we can build a more effective vaccine. So this will continue to get better, but in the meantime, it's critical that everybody understands getting vaccinated is still important. I would urge everyone to get the flu vaccine.
Last question.
We talked about the measles, but we didn't talk about the government's response. We talked about the issue. What is the government doing to control this problem?
Local, state, and federal government agencies are doing a great deal to respond to measles, and I've been encouraged by what I've heard. At a local and state level, we have contact tracing that has been taking place. That is, when we have someone that has measles, given how contagious it is, we need to make sure that we are carefully following people they may have contact with and making sure that if they develop symptoms, that they get diagnosed quickly. And our local and state health authorities, I should say, have a lot of experience in this department, as do our federal agencies as well. The Centers for Disease Control and Prevention has been assisting local and state agencies in contact tracing and making sure that diagnoses are made promptly, as well as in education of both providers and the public about measles. It's essential that we convey to the public just how serious measles is. This was many people who have grown up, in the last 20, 30 years in the United States and who have lived here during that time have not necessarily seen cases of measles. And we sometimes forget just how serious the illness can be. I'm concerned that we are, in the case of measles and in the case of vaccine-preventable illness, that we've become victims of our own success. Because we have done such a great job in the past at vaccinating our community, we've not seen illnesses that previously were a great burden to society. And in that context, sometimes people get a little bit lax about getting their vaccines and getting them on time. But I want to remind parents out there and remind everybody that measles is a serious illness. And while our local, state, and government agencies are working very hard to contain the spread of measles and to educate the public, it's important that everyone gets vaccinated, because that is the best way to protect your children and to protect the community.